Hello and welcome to our live stream. We're here with Dr. Andrew Kirkpatrick, a fellowship-trained hand surgeon with Orthopedic and Sports Medicine BayCare Clinic. He's board certified by the American Board of Orthopedic Surgery. Welcome, doctor. This live stream will focus on hand pain, numbness, tingling, and other hand and wrist-related issues. We'll learn about these conditions and treatment options available to patients. So before we get started, we want to invite you, our viewers, to join in the conversation. Excuse me. Go ahead and ask your hand-related questions in the comments section. While the information shared today should not take the place of a doctor visit, we want to create awareness as it relates to common hand conditions and potential treatment options. We'll do our best to answer your questions in real time. If we don't get to your particular question during the live stream, trust that we will get to it sometime after the conclusion of our broadcast today. Thank you again for joining us today, Doctor. Thank you very much.
Of course.
I do see that you have a guest with you today, which is great. Care to do the introductions?
Absolutely. I'm happy to be here. Thank you. I'd like to introduce Tiffany Terp. She's a physician assistant who's certified, who's joined my team, has been working with me for almost a year now. As I mentioned, she's a certified physician assistant, so she's a PA, qualified to see patients. She's a part of our team. She is qualified to do injections and assist in surgery. For the last year or so, as I mentioned, she's been a great addition to our team. I think the patients have really enjoyed getting to know her. She is new to our team, as in about a year, but she's definitely not new to being a physician assistant.
Right.
She's been a physician assistant for 8 years, and we were very lucky to sort of steal her away from a different medical subspecialty to join us.
All right. Well, welcome, Tiffany. Thank you for joining us.
Thank you.
All right. Well, Tiffany, we're going to send you backstage, but we'll see you again a little bit later, okay?
Sounds good.
Thank you. All right, doctor, well, let's get started. Dr. Kirkpatrick, the list of conditions that can negatively affect hand function is quite long. We're talking anywhere from osteoarthritis and tendonitis to carpal tunnel syndrome and trigger finger, and lots more in between. So hearing all that, how common are hand conditions?
Hand conditions are very common. I mean, you just touched on a few of them. I mean, as you can imagine, we obviously use our hands for just about every daily task that there is, whether it's work or sports or just activities of daily living. So they're incredibly common, and it's what we see every single day in the clinic.
Okay. So although we're primarily focusing on hand pain, numbness, and tingling, we'll gladly answer any questions about other hand and wrist-related ailments. So with that in mind, doctor, what are some of the hand conditions that you treat?
So like you mentioned, Femi, we treat a wide variety, basically anything that goes wrong with the hand, wrist, elbow. By far and away, the most common condition that we see in the clinic is called carpal tunnel syndrome. Mm-hmm. I know a lot of you listening may have heard things about it, or maybe have even experienced it. There's a graphic up on the screen that sort of depicts what patients tend to feel with it. Carpal tunnel syndrome is sometimes misinterpreted, but essentially it boils down to compression of a nerve, a pinched nerve, if you will. And in this case, it's the median nerve at the wrist level, and you sort of see that in the graphic there. The classic thing that people will feel with it is numbness and tingling in the hand. Although I will say we see multiple patients every single day with this issue, and people interpret it differently. Numbness, tingling, burning pain. These are the most notorious things, but other people will feel different things such as cramping, cold, feeling weakness, pain. And as you see in the graphic, it's the nerve pinched right there at that level we call the carpal tunnel.
Sure.
It can be worse with work activities, repetitive activities. It can just happen. And the notorious symptoms it causes, we mentioned, the thing that oftentimes brings people in to see us, though, is when the numbness and tingling doesn't go away, or if it starts waking people up at night out of their sleep and disrupting their whole lifestyle. Wow. That's when a lot of people decide to come in.
Okay. What else? What's some other conditions?
Yeah, so that was carpal tunnel syndrome. Another really common one we see is called trigger finger. And a lot of people will experience this where one or more of their fingers will either click and pop as they're trying to move it, and it causes pain sort of in this area where I'm pointing to. It can be any one of the fingers or the thumb. Some people will find that when they try to, make a fist and extend their fingers, the finger will actually get stuck. And we could get into the nitty-gritty details of that later, but
Sure.
It essentially boils down to inflammation of tendons. It's called trigger finger. We see that one every day too.
Okay. Give us a quick idea of some of the other conditions you treat as well.
Yeah, things like arthritis, as you mentioned, wear and tear of joints, tendonitis, so pain in the wrist, pain in the fingers, ganglion cysts, any lumps or bumps on the fingers or hand or wrist that shouldn't be there.
Right.
And then we see some more serious, more acute problems that happen in accident type situations, fractured bones, dislocations of joints, ligament tears, that sort of thing.
Okay. So in general, what are some of the culprits that you find cause pain associated with some of these aforementioned conditions?
Yeah, we kind of touched on repetitive activity, injuries, bicycle accidents, motorcycles, all kinds of sort of traumatic things. But then just living life can lead to arthritis, various repetitive activities. Sometimes an injury will start the cascade of arthritis and then just lead to achy pain later on. And then more simple things, sprains and muscle strains and things like that.
So it's interesting to me that some of these conditions cause pain, some cause numbness, some cause tingling, and some are just a hodgepodge of all three. But in your experience, what are some of the hand conditions that typically you find that your patients feel are the most painful?
Some of the most painful, obviously the real obvious ones that stick out are if you break a bone,
Sure.
A fractured wrist, we treat that routinely, sure. Fractured fingers or torn ligaments. But aside from the more acute injuries that happen with an incident, tendonitis type issues, inflammation of tendons can really cause people pain. Several specific forms of tendonitis around the wrist can tend to be pretty debilitating, which is the bad news. But the good news is people tend to be pretty satisfied when we take care of that pain and get rid of it.
Okay. And conversely, what are some conditions that maybe aren't as painful, but definitely exhibit numbness and tingling?
Yeah, that's a good question too. And the graphic we had up before is one of the more common ones. We touched on carpal tunnel syndrome pretty in depth, but there's similar nerve conditions that cause numbness and tingling. We talked about carpal tunnel syndrome, but there is one called cubital tunnel syndrome, which is more of a different nerve called the ulnar nerve being pinched at the elbow level. And that causes numbness and tingling in the fingers, but more so in the pinky finger and the ring finger. These problems can also lead to other issues, muscle problems, weakness, dropping things.
Sure.
But nerve compression, as we talked about, is the most common.
Okay. It's a really great start to our conversation. Thanks a lot. Well, let's keep it going. So is hand pain just to be expected at some point in our lives, maybe just as a natural part of aging?
It does happen to most of us. Like we talked about, we use our hands for everything. So yes, particularly when we get into the arthritis picture, it bothers some people more than others. But yes, as we age, definitely arthritis can become a debilitating issue. And a lot of people just decide to live with it. When in fact, if it's bothersome to you, we have plenty of options to make pain better, go away, even resolve it completely. The graphic that we have up on the screen shows kind of a very common area to have arthritis in the hand. It's called the CMC joint of the thumb, sort of where the thumb meets up with the wrist. A lot of people live with this. It causes them pain doing daily tasks, such as trying to open jars or twist or grab anything.
Sure.
Lots of things we can do to help that go away. Yeah.
Speaking of help that go away, what are some things that we can do at home to treat hand pain?
Yeah. There's splints and braces you can buy. We can help guide people in what the appropriate ones are to use. Obviously, simple things like ice, over-the-counter anti-inflammatories such as ibuprofen. There's anti-inflammatory gels out there. These things are all useful, especially in the early stages of some of these conditions.
Okay. In the same vein, what can we do at home to treat hand numbness and tingling? Or is that when we have to come in and see somebody like yourself?
Certainly happy to see you and talk about it, but with the most common cause, we talked about carpal tunnel syndrome, a simple wrist brace, just an off-the-counter or off-the-shelf wrist brace that keeps your wrist from extending or flexing, particularly when you sleep, if you're experiencing those symptoms at night times. That helps a lot of people sleep because it helps you keep from putting pressure on that median nerve at the carpal tunnel or stretching it out. So splints and braces can help numbness and tingling. But other than that, there's things we can do for you, and if you come in.
Okay, all right. So at what point do you advise people to seek the help of a specialist such as yourself to deal with ongoing hand pain, tingling, or numbness?
Yeah, I mean, pretty much any time. So if all these home remedies and anti-inflammatories and ice or these things aren't helping, we're certainly happy to help. Myself or Tiffany, we'll see you in the clinic. We can talk about easy things to do. If you've tried all of those things, there's more advanced things such as cortisone shots, injections, and plenty of surgeries that can easily resolve some of these issues. Okay. So anytime you want, really.
Okay. And then when someone does come to see you, they present with hand pain or numbness or tingling. How do you diagnose the problem? What do you do?
Got it. So a person comes to see us in the clinic. We typically start with x-rays. After a face-to-face talk, we find out what's going on with you. We sort of take a multifaceted approach. We make sure we get some imaging. We make sure we do a physical exam, talk to you about what things you're doing that specifically cause your pain, where it's located, if you have any associated symptoms. And so that's typically where we start.
Okay. And then the approach is the same, whether it's pain, tingling, or numbness. The diagnostic approach is the same.
We typically start with all that stuff in the same vein, yes, but then when there's more of a nerve issue involved, sometimes we go on to more advanced testing. Okay. Electrodiagnostic studies, for example, people may have heard of an EMG test. Sometimes that's helpful in diagnosing. We have the capability of diagnostic ultrasound in our office. That oftentimes helps distinguish some of these issues from other causes. So sometimes it moves on to more advanced workup after that simple stuff.
Okay. And then you probably touched on this a little bit, but at what point do you say, hey, I think, the only course of action left is a surgical course? When does that come to play?
Yes. If people are dealing with pain or numbness and tingling, any of these symptoms we've talked about, and it has not responded to these other modalities, we're not quick to jump to do surgery on people unless they've already tried these things. If we think there's a chance you're going to get better without surgery, then it would be unnecessary for you. Sure. But there are a lot of these conditions where surgery is the ultimate answer to make people pain-free and get back to the level, of activity that they want to be at. Sure. And so we kind of tailor it, custom-made, approach for everybody.
Okay, that sounds good. Well, thank you again for sharing your expertise, Doctor. For those of you just joining us, we're hosting a live stream focused on hand pain, numbness, and tingling, and other hand and wrist conditions. We're learning about these conditions and treatment options. We want to invite you, our viewers, to go ahead and be a part of the conversation and ask any hand-related questions you may have. We'll do our best to answer those questions during our live stream, but if we don't get to them for some reason, rest assured, we will respond to them sometime after the live stream ends. So let's kind of move right along. Dr. Kirkpatrick, you occasionally will recommend that patients see a therapist after surgery to help them regain the strength and maximize their range of motion and decrease the chance of re-injury. Talk a little bit about what occupational therapy is and its importance in terms of post-surgical positive outcomes for your patients.
Got it. That's a good question. Yeah, I failed to mention therapy. A lot of times that will be something we do even pre-operatively, or can sometimes prevent surgeries. The therapists that we have in the hand clinic are occupational therapists, and they do a lot of things: ultrasound, stretching, strengthening, various types of splints and braces, and that helps a whole lot of people feel better. In addition, you mentioned post-operatively. If you have an injury such as a fractured bone or a lacerated tendon, a cut tendon, something like that, that we fix in surgery, then to help guide you with the rehabilitation process to get back to what you want to do in a safe manner, that's when the occupational therapists are very helpful.
Okay, good. So then does every hand condition we've discussed today require some sort of therapy and rehabilitation post-surgically?
Not necessarily.
Or pre-surgically, now that you mentioned
Right.
it too.
Right. No, not necessarily. A lot of these things people can do home exercises on their own, which we provide, and we go over them with them. It's some of the more severe injuries, like I mentioned, fractures or tendon or ligament injuries, that the therapists are really good at guiding people through. Some of the more routine things that we deal with, the trigger finger that I mentioned, the carpal tunnel, those patients most of the time don't need any formal therapy.
Okay. Let's switch gears a little bit. Doctor, you're a fellowship trained hand specialist. That means you've had additional training in hand, wrist, and upper extremity injuries and conditions. Talk a little bit about what that means for the care you can provide your patients.
Yeah, we feel it's important in our practice to be subspecialty trained. So not only, in orthopedic surgery, but also, like you mentioned, hand, wrist, and upper extremity surgery, which for us includes elbow, sometimes shoulder. So subspecialty training is just that. And we feel like, if that's what we deal with on a daily basis, we feel qualified to address anything that you would perhaps be experiencing with these areas of the body. And in our practice, we have experts in almost all of the orthopedic fields. So if there's another part of your body that's bothering you, then we have specialists for that.
Right. So does that mean this extra training kind of gives you a little bit more of an understanding than the average bear on how to treat conditions like those that we're discussing today?
Yeah, of course. As anything in life, we spend more time studying it, dealing with it. We learn the intricacies of, what's causing these problems, and then how to make people feel better from them. So yes, we like to think so.
Great. Thank you so much for explaining that.
Yeah.
Doctor, I think we'd be remiss if I didn't mention the fact that you treat more than hand and wrist conditions. You treat hand and upper extremities. Talk a little bit about that. What does that mean?
Yeah, in the hand clinic, myself and my hand surgery colleague, we treat a lot of elbow conditions. So by far and away, the most common is called tennis elbow.
Oh, yeah.
It's a tendinitis about the elbow. People with sore elbows. We deal with arthritis of the elbow, broken bones of the elbow, sports injuries, all kinds of things. So we deal with a lot of elbow, wrists, hand conditions, as you mentioned.
Okay. All right. So we have covered a lot today. Is there anything else that you'd like to add? Maybe an area that we didn't explore that you'd like to quickly touch on?
No, not necessarily. I mean, we're talking about some things that can be pretty debilitating, but we see people with more of just more curious concerns too. So it doesn't have to be a super serious concern to be seen in the clinic. A lot of the times people want to come in and just be reassured and not necessarily get an injection or talk about surgery or anything like that. So reassurance is oftentimes beneficial for people as well.
Good. All right. Well, some final questions for you then. Tell us again, when should we see an expert such as yourself for hand pain, numbness, or tingling?
Yeah, we kind of touched on it, but honestly, anytime. But for me, it's more beneficial, if one of these issues is impacting a daily activity for anybody for any reason. With carpal tunnel, it can be impacting, sleep or your work,
Right.
or any sporting activities, and more with the more arthritic or degenerative type conditions, it can just be pain at rest, pain with activity, really anytime. It's pretty easy to get in and see us.
So I'm glad you said that, because that's sort of a follow-up question for me. It's easy to get in and see you. Is a referral needed? Is anything like that needed? Anything hindering somebody's ability to come see you?
Nothing hindering your ability to come see us. You can call the clinic. We will get you in. We don't really turn anybody away. Like I said, even if people have something that's not deemed by other providers to be as serious, but it bothers you as the patient, a lot, then we're happy to address it. And sometimes it ends up needing an intervention, sometimes therapy, sometimes just a brace, or even reassurance like we talked about.
Great. Well, thank you so much, Dr. Kirkpatrick, Tiffany. There she is. Thank you for joining us today. The information you shared today, I'm sure, is valuable and helpful to people looking for such information. And I thank all our viewers for joining us today. If you have questions for Dr. Kirkpatrick, please go ahead and ask them in the comments section. Oh, well, let's take this question before we wrap up. So somebody's asking if you have a radial tunnel injections in your past and you're still having pain, can you get those injections again?
In general, yes. In general, yes, but it kind of depends on what type of injection and how soon and how often you've had them. But those are kind of more detailed, specific questions I'd be happy to address with whoever that person is. But in general, yes. Of course, a lot of intricacies that can be involved with cases like that. But
okay. All right. So we can respond a little bit more offline. So, but thank you for your question. So again, if you have additional questions for Dr. Kirkpatrick, go ahead and ask away. As you can see, we will respond. Again, Dr. Andrew Kirkpatrick is a fellowship-trained hand surgeon with Orthopedics and Sports Medicine BayCare Clinic. He is board certified by the American Board of Orthopedic Surgery. Tiffany Terp is a physician assistant, and she is also with Orthopedics and Sports Medicine BayCare Clinic. We thank you all so much for your time. Thank you too for your time. Thank you for watching, and have yourselves a great day.